All right, I want to welcome all of you in to Coronavirus Inside the Arizona Numbers. We start with always saying the date. I noticed today was Friday the 13th, Garrett. So
Oh boy.
hopefully superstitious. Friday the 13th, 2021, and we are going to get to all the coronavirus numbers, help you make sense of some of this, and then help you to find the information you're looking for. Garrett looks at these numbers all day long and helps us help you find where to find this information when you have questions or concerns. First of all, in the comments, I want to hear how all of you are feeling right now with everything that's going on. I know last week a lot of people were saying frustration, and I'm wondering if that's changed or kind of stayed the same for you. But Garrett, let's start where we always do with those numbers and the state's numbers today. I know yesterday was a very high day.
Yes. So the AZDHS reported 3,225 cases on their dashboard yesterday. That is, or this morning. And that is the highest number of a daily report I'm looking right now since February 6th. It was the last time that we broke 3,000 cases. So now 20 and the 23 deaths, that's actually a little lower than it had been for the last couple days. We had a couple days last week, August 6th and 7th, where we had over 30. This is the highest so far for this week. It looks this 23 is the highest so far since that day we had on the 7th. So which would technically be last, because it was Saturday, so that would have been last week. So yeah, this is the highest death numbers we've had this week.
I'm sure you look back at the dates at some of those. Were those plugged in just within the last couple of days, or were they?
Yes. So when you look at the numbers for the epi numbers, and I'm pulling up my little screen here, what I can see is 11 of those deaths, so about half, were from the last 3 weeks. Now with deaths, very often it's from 4 to 5 weeks. That's pretty much a normal time for those to be added. So these were added in the last 3 weeks, 11 of them. And then we have 3 of them that were added much earlier. Sometimes we've got one in January, one in March, and one in April. Now there is a balance obviously on that. Because I only said 11, 13, 14, 15. I only said 15 deaths. So there's a balance. That means that this was just the others were already in the system somewhere, and that they were added in, but we already had them someplace. So they may have been temporarily withdrawn, but they were in there. So.
Okay. And then when that breaks down by county, I know Maricopa County has by far had the biggest grouping in that. Obviously, we have the now 5th largest city in the U.S. here in Maricopa County. But can you explore some of those numbers for us?
So as typical, Maricopa County makes up about 70% of the population. So this is, as you can see, 2,000 of today's tests, positive tests, came from Maricopa County. And then we see 14 of the deaths came from Maricopa County as well. The number of vaccine doses in Maricopa County are typically the highest, and that's at 9,000. And let's see, what else do we have here on the number of, we don't have, there's the tests. New tests reported today, 23,000. That looks like that's everybody. Let me just check that. Nope, that's not everybody. 23,000 today reported. That's a very high number of tests. Our test numbers are increasing. I did get a chance to speak to the one of the people that works with, I think he runs Embry Women's Health. And that's one of the major testing providers in Arizona. And they said that their testing is increasing, but their positivity rates are not. And we're seeing that in the data. So as our testing is going up, more people in the community are getting tested, but we are not seeing an increase in the positivity rate. In fact, the average positivity rate in tests right now is actually falling. And this is a great sign, because typically when it starts to fall on a regular basis, that means that the test will follow. But we have seen situations in which it was a temporary fall of the testing positivity rate, and then it started increasing again. But so far, we still are in a fall. We've been falling for, it looks like, since the 9th, which was at 14.6, and today we're at 14.2. So
So
still a
incremental,
very
but
high, yeah, still very high positivity rate, but nowhere near what it was during the surges, and it's also falling. So these are pretty
yeah,
good. And lies. All these people, these lovely people that are saying lies. No, this is actually data from the AZDHS,
yeah,
and I know you want to say that their data is fake, but I assure you that their data is not fake because it is put into the system by multiple providers, not just one person pushing a button that has some sort of unseen hand. This is put in from health departments, laboratories, multiple places. So this is as trustworthy as data as we can get. Obviously, this data moves. It changes on a regular basis as the epidemiologists at the health departments are researching this data. And so sometimes there'll be changes, modifications. Sometimes deaths will be withdrawn. Sometimes, like today, we'll have some that are added that were already in the system. This is all typical of health department data. As we used to say a lot when we were doing this on a daily basis, the health departments are used to looking at this data and putting out sort of one report every year on this data. Because there's so much research involved in any sort of health data, so they're used to doing at least just one report a year. This is what happened this year, and now they're showing this in real time, and so we also have to deal and just accept the fact that there's changes that are made on a regular basis.
Yeah. Emily Davis is writing, do you have any numbers by zip code? Is that still updated for us, Garrett?
Yes.
And Emily, we're lucky enough that I'm hoping, Emily, first of all, that you're in Maricopa County. I know that we have people watching from all over the U.S. and around the world as well. In fact, let us know in the comments where you're watching from. But if you're watching from Arizona and you are in fact in Maricopa County, we're lucky enough to get a detailed look at that zip code by zip code. And Emily, we want to show you where you can find it all the time.
I'm gonna
when we're not here with you.
I'll walk through this a little bit, but I'm just going to show you there's a little button on the AZDHS where you can go to zips. Once again, I just want to drop some of these as I see them in the comments. The COVID-19 cases has very little to do. The surge has very little to do, if any, with any sort of migrant surge we're seeing at the border, and that is indicated by the fact that as of right now in Maricopa or in Arizona, the southern counties have a much lower rate of growth of COVID-19 than Maricopa County and the northern counties. Right now, we are seeing more growth in northern counties, Maricopa County and Pima County, but not in places like Yuma, not in places like Santa Cruz or Cochise. These are border counties, and we're not seeing growth there. So I know that this is very attractive to some people to say these things because it helps kind of confirm their worldview, but it's just the data doesn't show this.
Yeah, and not only that, Garrett, you look at Florida, they do not have a southern border.
And they do not have a border, and their surge is going much worse than ours, and they do not have a southern border.
You're much nicer than I am because I wasn't even going to address those comments at all.
I'm just it's we're now that we're doing this again, we're starting to see this, and it's very, very disappointing to see some people in the comments just being contrarian to be contrarian when there's just literally no data to support what they're doing. But anyway, going back to the zip codes. When I go to the zip codes to see I'm going to full screen this. And I'm going to take you through, it's very, unfortunately, because of how AZDHS does this, you can see that Maricopa County is all red because there's greater than 1,000 cases in almost every zip code in Arizona or in Maricopa County. So I'm just going to go through some of the zip codes that have had the highest numbers this week so far. So I'm going to start with Queen Creek because Queen Creek has had the highest numbers added to their system in the last couple days. So we have 85142, which is right here. That's at 10,000 cases. They've added 237 cases this week. Its neighboring zip code, 85140, which is also in Santan Valley. That would be this one, I believe. Yes, this one is the second highest with 209. The two other highest zip codes are right here in Chandler. This is 85225, and that's at 181, and 224. That's on there too at 132. There's actually another one in Chandler. So as you can see right now, we're seeing a large surge of cases in the East Valley right now is where we're seeing them.
So Garrett, what I'm hearing from you about this particular map, although color-wise it doesn't tell us much because it's so concentrated, If we click through it, and if you click on your particular zip code or one you're concerned about, maybe where your kids go to school, if you click on that, then you'll be able to see the actual numbers behind it.
The actual numbers, yes, behind that.
Yeah.
And there's a search bar right here, so you can search your address, and it will geolocate you and go to where you need to go. But obviously, as you can see, the difficulty is that you don't really see a lot of deviation with this map. Now, the Maricopa County has a separate map that will show zip codes. It's only we used to go through this thing all the time, and it's updated once a week now. But this one, it's a schools dashboard. But again, right now we're not seeing a lot of deviation in the numbers. So I'll just share this really quick. If we have time, we'll go back to this at the end of the session to go through some of these zip codes. But here's the Maricopa County zip code map, and you can see pretty much every urban zip code is red. And we only have some very, Fountain Hills is the only zip code that is considered a suburban zip code in Maricopa County that is a different color. All of these others, this one here, there's almost nobody lives in these zip codes right here. So they are almost always in the blue or in the orange or in the yellow. But really, it's really the zip codes that start at Fountain Hills and go all the way around the Phoenix City Center is what you want to look at. And these zip codes, as you can see, are all red right now. And this goes all the way down to, you look at the city. We do have an orange substantial transmission in Paradise Valley, very not a very dense area of Maricopa County, very wealthy area. We have the high school. Let's go to the Unifieds. All of the Unifieds are in red. All of the high school districts are in red. And that would go to show that all of the elementary schools, with the exception of some very rural elementary schools, are in red as well.
Yeah. Okay. We'll come back to this if we have more time. I want to answer some of these questions. Joe is writing, is the current surge projected to be the highest it has ever been during the pandemic? So this is not set to match what we saw in January, is it, Garrett? Some of our prediction models help us better understand.
So that's a great question. And there's actually competing data on that. Now, I'm going to go to IHME, University of Washington, to look at the forecasting data. What I can tell you is that there is a chance that the surge of cases will be higher than January. But as of right now, no experts are predicting that the surge in deaths is going to be as high as January. And that is simply because we have 80 to 90% of our vaccinated individuals in the 65 and up age category. The most at-risk individuals to COVID-19, 90% of them in Arizona are vaccinated. So that is why we see cases right now are absolutely being driven by under 20, 20 to 44, those age groups. But they are, they are absolutely less at risk to a major severe reaction to COVID-19. That's just a fact of how this whole thing operates. So let me go to.
We'll go to IMHE and Joe, we'll show you where we're finding. I think, Joe, you're in Arizona because you've joined us on here several times, and thank you for being here with us again. So we'll pull up Arizona numbers, obviously, because we're here as well. But this is really great. I mean, I find this helpful. I had plans or was hoping to make plans to travel in October with my family for fall break. But then I can go on here and pull down the bar at the top where it says Arizona right now. You can choose any state or any area and see where their projected peak is as well. So if you're thinking, oh, I might go to California, or I might go to Texas, or I might go to Colorado, then you're able to pull that down and see when they're expecting that peak. So that's really helpful. We'll take a closer look at Arizona and what we're looking at experiencing in October here.
Yes. So there's two projection scenarios that the University of Washington put out. And I'm going to start with daily deaths because this is forecasters use deaths as the most reliable metric simply because it is the most, sadly, it's the most stable net metric we have with COVID-19 because we don't know what the case numbers really are. There's projections that case numbers could be 4 times higher in a surge than what we actually record because of just certain individuals not getting tested. So that's why they use deaths as the one of the leading indicators of what's actually going to happen. So as you can see, there's this projection of what they really think it's going to be, and then they have a worst case scenario. Okay. And this is basically, as you say, in those who are vaccinated, mobility moves towards pre-COVID-19 levels. That's what they say. Now, of course, it's hard to say what mobility to pre-COVID-19 levels are. Obviously, in Arizona, the vaccinated have moved to a degree to mobility to under pre-COVID-19 levels. But this is still the projection they think it's going to be right now. So as you can see, October 21st is projected to be sort of the height. October 1st to the 4th is projected to be the height of daily deaths, either in both the regular scenario or the worst case scenario. But even in the worst case scenario, the deaths do not exceed where they were in January. And we can see that in hospitalization resources too. You can see that in the bed capacity issues. You can see January 10th, this was very much the height of our COVID-19 surge here in Arizona. And you can see they do not believe that we will have that same situation. They think that in September 21st, in fact, middle of September, that's when the hospitals will reach its peak, but it will not reach January. So we go to infections. This is the one area where it says, okay, worst case scenario, we definitely could see more infections than what we did in January. Now, this infections is not what we report on a daily basis from the Arizona Department of Health. This is the infections that they believe is the actual projections of the people who are infected on a daily basis. So this would include people that do not test their kids. As you know, I've had COVID-19. My wife had COVID-19. We did not test our daughter because there's no reason to test a 6-year-old when there's 2 of you in the house that have COVID-19. Because the daughter is going to get COVID-19, so we did not test her.
And I'll mention this was last year.
This is last year. Yes,
we're not open. This is when this was going on.
Yes, this is back in January, and that's going to be a very typical scenario for most families. At least it was. Now we're seeing a lot more kids being tested because school is back in session. But as you can see, they do think that there's a possibility that the case numbers can exceed what we saw in January. But as we talked about, the hospitalization and deaths will not exceed what we see in January. And these projections have gotten very good over the past year. So, it's going to fall somewhere between, when we look at this worst case and projected, it's going to fall somewhere between this line, probably closer to the darker line than the lighter line, but it's still going to fall somewhere between that. They've been very good about getting these projections correct. This site particularly, I wasn't the biggest fan of this site early on because they were using, and the thing with forecasting is the more data you can ingest into it, the better it is. And so now that they have a year of data to ingest in it, it's gotten quite good.
Yeah. One of the questions that I keep seeing come up in the comments, Robert's just asked it, and Angela asked a little bit ago, she had asked how many were vaccinated, and Robert's asking what percentage of
what's the breakout
have been vaccinated. That's the data we want, right?
It's a good question. The data we do have, and it's a little old, it's about 2 or 3 weeks old, but the last time the Department of Health put out this metric, we had a breakout rate of about 10% because of Delta variant. Delta variant does typically have a bigger breakout than the others do. And so we have about a 10% breakout rate. That's where we were. It might be a little higher. We've seen other countries where the breakout rate is higher. But what they do say is that even with a higher breakout rate, the number of severe infections from COVID-19 is very, very low on breakouts. Now, the data we do not have is the number of people that have had COVID-19, are also vaccinated, and received and got COVID-19 a second time. We do not have that data, so we just don't even have it. So there's no projection, there's no nothing. I don't know what that number is.
So Mayo Clinic is saying that this study that they've done, of course, needs to still be peer reviewed, but that, and I just want to stress here, vaccines don't last forever, just in case there's confusion on that. You don't get the vaccine and it lasts forever. This is a vaccine that you'll need to keep getting shots at different periods. They believe that it's losing efficacy at a rate of 6% every 2 months. So kind of do the math on when you got your shot, and then that is why some of the conversations are starting about a third shot. Now, for me, I volunteered at one of the sites to work to get people their shots, and because of that, my shot came very early. My first shot was in late February and into March. So I'm already 6 months beyond that. And again, this is a Mayo study that has not yet been peer reviewed, but to lose 6% efficacy every 2 months, that's why the masking is coming back into play at this point, Garrett.
And what I don't know, because I haven't seen the study yet, but I would be interested to see if that is an average of all age groups. Because what I would just speculate right now, and again, this is pure speculation, is that that efficacy might be different for older individuals to younger individuals. So
And
a younger,
immunocompromised.
yeah, I mean, like a 20-year-old that was vaccinated in March, they could lose much less percent than, like, say, someone who's 65, 75. But again, that's the group that really needs to keep the stay vaccinated.
Jordan's asking, where and when can immunocompromised get a booster shot? So this happened late last night that this went through, Jordan, closer to I'd say about 9 o'clock our time. And then everything went through for approval today. So 1.1 million people have already gone and gotten that booster shot. I recommend you talk to your specific doctor about whether that works for you, and that's something you should consider. But before that approval even came at 9 o'clock last night, we had more than 1 million people who had gone to get a third shot to try to protect them and really get them to where, Garrett, they should have been in the first place with these shots, that in a healthy body, assuming that we have healthy bodies right now, that if a shot was given to us, it would last longer than somebody who is immunocompromised. So they would need a third shot. So this was really crucial in getting this approved today. So if that's you, if you're in that group, I listed some of the groups that is. If you're on, if you have cancer, if you're a transplant recipient, you especially want to talk to your doctor about this. So that's the group that should speak up about it to their doctor at this point. Okay, let's see. I think it was Celine. Somebody asked a little bit ago about kids and hospitalizations, and I want to get to those numbers as well. We don't have a breakout outside of 20 and under, so we always want to talk about the limitations in the numbers that we get here in Arizona.
Yes, let me see if I can find. I had this a couple days ago up, and then of course, I moved on to something else. But what I can tell you,
Cecile. Sorry, I couldn't read my own writing, and I wrote Celine. Cecile, thank you for the question. So she's asking about hospitalization.
Yes.
COVID and kids.
So this is what I can tell you. I can tell you that first of all, statewide hospitalization numbers by the AZDHS, the trend line is very noisy. And I don't like using it for much of anything, especially in the age groups, because, like, for example, I'd say back in June, I did that today. It's one of the things I did today. And I realized that back in June, for example, the AZDHS added like 700 hospitalizations for under 20. Just to that, and this was not in surge period. And so that made no sense. They were adding 700 hospitalizations from, like, basically the very beginning of the pandemic. So basically a year's worth of hospitalizations for kids. But because of the way that the trend lines are built in, it really messed up everything. So don't try not to use the AZDHS data for anything, but just looking at the total raw numbers that they're giving you as far as the number of people hospitalized. Now, that being said, if we look at, I'm trying to find the data right now with Health and Human Services, but I can tell you that based on what I've seen with Health and Human Services, as well as just some of the most recent trends with the hospitalization data, which if I only stick within the last week or so, it tends to be a little bit more accurate, unless they do one of those big, we're dumping 500 cases on there. We are going up. So we looked at about 7 days ago, the average hospitalization, 7 days ago, it was about 1% of hospitalizations were under 20. Today it's 6%. So we're definitely increasing in hospitalizations for under 20. Still a very low number, obviously. I mean, 6% of the daily share of hospitalizations are from under 20. Very low number, but it's still increasing.
Yeah. Nicole was asking about the breakthrough infections again being tracked in Arizona. We just talked about that a little bit ago. Those numbers, are they out there anywhere? I mean, we were talking Arizona, but nationally they're not out there.
I have not seen them in a good place nationally. So I don't have anything with breakouts that I can really work through, except for what AZDHS gives us tidbits here and there. This is one of those things where a lot of these dashboards, a lot of this was built with not in the understanding that people were going to get reinfected.
Well, and on the fly. I mean,
exactly.
These sites, I mean, remember last March, we were kind of throwing everything together as we were.
Yes, exactly. They've gotten much better, but still.
So when we're talking about vaccinations, I do want to have a moment of hope in all of this too, and look at the numbers that we're seeing here in Arizona. Are we still around about 54% at least have their first dose in Arizona, or is that climbing a little bit more? I know that all this news of the Delta variant seems to be inspiring people who were
so we have a slight increase in vaccinations. Sorry, we've moved on. Vaccinations, and so today for example, we reported 16,000 vaccinations. So let me just pull up the chart so everyone can see it. You can see the sort of the increase that we've had since I want to say early July when we hit our floor. This is the vaccination. The yellow is the trend line here. Now I have to recalculate this, so kind of ignore this downward a little bit. It seems to be going down, but I don't know. It's probably not dropping like that. So just ignore that little tail. But you can see we did hit a floor sometime in mid-January. We had a little bit of a bump, and then we started to see a gradual increase. This is about the same time as our surge started around the same time, and so vaccinations subsequently increased for that.
Yeah. So we'll continue to track those numbers. Is that your own graph, Garrett? Or
This is my own graph,
okay.
Yes.
Okay, because I wanted to answer, let's see, Tina's question too. She's saying, I wonder why you can't readily find this information. Maybe it's because they don't want to paint that picture.
No, you can find it. If we're talking about the breakthroughs, Tina, yeah, it's a little frustrating that we can't get the breakouts, the breakthroughs on a regular basis. I will agree with that. Because it doesn't paint a full picture. But we're working through some of those things with the Department of Health to get what we can from them. So they to give them credit, they have been very responsive. If I call them and say, hey, what's the breakout rate? In fact, I should have done that today. That's my fault. I should have called before this thing because they would have been responsive. They would have called.
A little bit going on.
Yeah, they would have told me, oh, here's the breakout rate. So they've been very responsive, but they don't have a function to put it on the dashboard right now, and that's what they're working through. So it is 53% right now. 54% is the percent of people vaccinated with one shot. So that we're still only about 47% fully vaccinated.
Yeah, Rayanne, I hope I'm pronouncing your name right. I hope that you're feeling better soon, and hopefully it wasn't too bad of a breakthrough case that you're experiencing. From everyone I've talked to that has had a breakthrough case, I mean, they say that it's like so light that they wouldn't have even gone to get tested because I had one friend tell me today, I just lost my sense of smell and nothing else. She has had her shots and then went to go get tested and was surprised to learn that she was positive. So the vaccines are working, even if there's breakthrough cases, they're still changing the situation. So Rayanne, I hope you feel better very soon. It's no fun. Let's see, Garrett, we were going to look at some of those vaccination numbers and I know you showed us your chart. I think the COVID Act now also has a state-by-state breakout. Do they have that on there?
Yeah, let's go to COVID Act now. We haven't been there in a long time, so we'll pick that out here.
If you're planning on traveling to other cities and you wanted to know how things look there, I was recently traveling to Milwaukee for the games, and you could see county by county what the breakdown was. There was a very high county in Wisconsin with vaccination rates.
Yeah, so here we are. You can see if we look at it county by county, when we step in Arizona, you can see the highest vaccination rates are in the northern counties. This is not unexpected at all. That is the Navajo Nation is there. And these areas, as you can see, the Navajo Nation has, I think the tribe, President Nez actually did say that they think that they have about 98% vaccination rate on reservation.
Incredible.
So yeah, and you can see, and this is one of the things we're talking about again with people, talking about the migrant situation or whatever. Santa Cruz has an 82% vaccination rate. Santa Cruz is this tiny little border county right here, mostly Hispanic county, and it has one of the highest vaccination rates, followed by Apache and Coconino, both tribal counties. Coconino is a little bigger. It does have Flagstaff. And then you see we've got Pima County next, Navajo County, and then Yuma County, another border county. In fact, the lowest vaccination rates are found in the north. We have Mojave County. That's the county near Las Vegas. Bullhead City, Kingman, La Paz County has a very low rate. Yavapai County has a fairly low rate. Pinal and Maricopa are the two, major counties out here. Maricopa is just at 51%, Pinal at 46%. So, that's where we are with our vaccination rates.
And Garrett, when we see, it's kind of frustrating when you see those low vaccination rates in Mojave County, and they're one of the areas that had to, specifically in Kingman, ask for the federal government to come in and send some healthcare workers there because they are in such a crisis. And you see that directly reflected. You see low vaccination numbers in Mojave County. And then the request for nurses, traveling nurses, they were just granted 28 to travel there. Only 2 other states are the only places that have had to ask the federal government for something like this. Arizona, the third. in that area.
Yes, and they don't have a very, I mean, they just don't have a very robust healthcare structure up there. I mean, they only have a couple hospitals in Mojave County, so they're going to have to. I don't know what I don't know what the diversion looks like right now. I don't know what we're diverting or if we're diverting. I know that when Yuma County in the south was at one point having a major breakout, Yuma County was diverting to Pima. The Yuma General or the Yuma County Hospital was diverting to Pima County. I don't know what's happening in Kingman in that respect if they're diverting to Flagstaff, but even Flagstaff isn't that big of a town. So they really, Las Vegas is the closest major city to most places in Kingman.
Yeah, to fly somebody out to get the help that they need. That's worrisome.
Yeah. Okay. So you can see, you've got high vaccination rates on the eastern seaboard up here, fairly high on the California coast, low vaccination rates in these are very rural counties. You're not going to have a lot of people in these areas anyway, not very dense. And then obviously, Florida, South Texas, you do have also larger vaccination rates, but really it's these rural counties in the middle where you're not going to have very high vaccination rates right now.
We highlight the work being done in Maricopa County to get us a lot of numbers out there. One other area that's giving us a lot of information is actually the city of Tempe and their wastewater program. Yes. that they have been tracking the amount of COVID in wastewater. It's a fascinating look at how things are, and it can even predict the situation there because it's in real time. It's a flush and it's a track, and it's before some people are even going to get tested. So it helps to provide us with a little more information, and they are still updating that, Garrett, and they have also these past months.
Let me see how far back I can go with this. This is going to be interesting. I'm going to try to go back to June, or excuse me, August of, sorry, I'm trying to see, where am I? All right. August, same time last year, because they had this last year. So let's see if they had this. Oh, but they do. Okay. Wow. Look at that. All right. I know this is kind of difficult to read, but I wanted to show you this in its entirety first for the entire year, to sort of show this. This graph is what's called a logarithmic graph. Logarithmic graph. So sometimes it can be a little difficult to read. So this is the parts per liter in wastewater. You can see 10,000 parts per liter. This is when it gets down to here, it means it's basically untraceable. They don't have enough below quantifiable level. 10,000, 100,000, 1 million, 10 million. So those are obviously exponentially growing every time it goes up. So that means that the chart's going to kind of stay compacted. So that being said, you can see that the highest number ever was this blue one right here, which is collection area 1, which is most of Tempe. And that was last year in September. And we basically, that's when ASU opened. We actually have numbers that corroborate that, with that number just increasing, skyrocketing for just a temporary amount of time. But you can see most of it really happened in again, the surge of last year. And right now there are certain parts of Tempe that are seeing increases, nothing over 1 million, 1 million parts, but it is, it's you can see there was a time when there was not much going on, and then it's starting to pick up again. So I'm going to go back to this last year. See, oh, sorry. Let's go to this. And what day is it today? I'll put in 2 weeks. There we go. No. I'll give us a little more time. Sorry, that's my fault. Let's go to there. And then, come on, dude. All right, there we go. Okay, there we go. There's good. Okay, so this just shows like where the increase has been. And you can see that City 1 collection area, which is also the largest collection area, has always sort of had some presence in the last 2 months. Right here, it didn't have presence. It did there. And then it's back up. It was the highest on July 4th. Now it's back up to kind of where it was between that. That's collection area 1. We look at 2. 2 is this area of Tempe. And you can see again, not as high as it was in July. Collection area 3, it only popped up, and collection area 3 is right here near Guadalupe. That only popped up in July. Otherwise, it's always been not quantifiable. 4, West Tempe, this area again lower than it looks like it's about where it was, 104 to 50. No, it's again logarithmic, so it's hard to read these things. It was at 54. It was at 118, and now it's at 54. So it actually dropped pretty substantially. Collection area 5, it's at 85 right now, but was at 437 in July. So lowering numbers here and there. This one wasn't even traced right there. But we have 284 right now in collection area 6, which is this little tiny area of Tempe, and then 7, which is ASU. I think that's ASU, right? Oh no, it's near Mill Avenue. Yeah, it's Tempe Beach Park near. So it's basically Mill Avenue and parts of ASU, and you can see they're at their highest number right now at 420.
So it's super interesting to kind of take a peek, especially if you live there in Tempe. It's something worth taking a peek at. I know it was confusing for a lot of people who were looking at the school numbers. Remember this last year, Garrett, when they were trying to decide, living in Tempe, thinking of sending their kids back to school, and then the school numbers would be skewed by things happening at ASU, and they couldn't get like a true sense of what was going on. And this wastewater number can help with that. So we're lucky enough to have that here.
Yes. So I was looking at the comments, and I'm just wondering out loud, at what point when the FDA finally does a full authorization, the people that like to say, "Oh, I'm not getting an experimental vaccine," because they love using the word experimental. It is not experimental. How the goalpost is going to move for those people, because they can't call it experimental. It's not experimental now, but they like to call it experimental. So I'm just wondering out loud on that.
I know. No, we were just having that discussion last night. That's a pretty tough thing to stand on if you're not willing to change your views on vaccinations, because it is about to change and it will get full. It's
gonna get full approval in the next month or so.
Yeah. So I'm curious if anybody's still in the chats who have not gotten vaccinated. Honest, real question, hoping for a real, solid, true answer. I know that's a lot to ask. Why? What is holding you back at this point? What is the main reason for you to not get vaccinated at this point? So super curious in the comments what some of those answers are, and we'll wait for those. In the meantime, more and more businesses and employers are moving to require vaccinations to work in the workplace, and that includes Banner Health, Valleywise Health, Dignity Health, several other hospitals here in Arizona requiring that. And then also, as we reported to you yesterday, the mask requirements going back into place, both for ASU, NAU, U of A, and 10 of the Maricopa community colleges. So all 10 of their community colleges and all of the district offices as well. So if they're going to see you in person there, they want to see you in a mask. So that is, I'm sorry, Rosa thought it was a stupid question.
No, and that's okay. And James here is saying that's my choice, and I respect that. And my thing is just like the people who are going to make these arguments, you have to make proper arguments. It is not an experimental vaccine. There is when you're talking about science, the word experimental has a very succinct definition. And there was a time that the vaccine was experimental. That time has passed, and it's been quite some time. That's why it's an emergency use authorization. It has gone past the experimental phase. It's about to go into full authorization. So to me, just use the correct, it's not an argument. Don't use a fake argument. All we've been dealing with for a year now is fake arguments on the election, on COVID-19. Don't use a fake argument. It's not experimental.
Exactly. Alex is writing, I thought it was a very valid question. Thank you, Alex. Edward's waiting for his doctor to give him the okay. And a lot of people saying my kids are too young. My kid's 7, not old enough to be vaccinated. We're going through the same thing here. Obviously, my oldest is 9, so not anywhere in the realm of conversation yet. Yeah. They said that they need 6 months worth of data, and that's going to push us at least beyond Christmas. So, Garrett, what are the numbers you're going to be watching closely next week and in these next few days?
So I'm looking to see really if the trend lines of the case numbers are going to speed up or slow down. Right now, they are slowing down slightly. I want to see if those numbers continue to slow down, because that's obviously the most hopeful thing, is to see those numbers just slow down. I don't think we're anywhere near the hill yet. I think we're not going to peak for at least another 2 to 3 weeks, but hopefully this peak is more gradual. And so I'm going to be watching those numbers. I'm going to be watching the hospitalization numbers, obviously, because that is what leads to, unfortunately, what happens to the deaths next. And just sort of, wanting to see when this particular surge sort of runs out of steam. That's really what's important to me right now is are we going to run out of steam? Hopefully we do run out of steam on this surge. I said we're seeing some signs that show that we might be slowing down, and hopefully that stays the way they are.
Yeah. I'm just reading some of the comments here. Amanda's hearing from Kyrene School District, Apprende Middle School, that they just notified all the 6th grade parents that they're one step away from going to remote. And that has been the real concern in all of this, is that if you have enough cases, they're going to send your kids back remote. So if we don't have these kids masked up, and obviously being too young to get vaccinated, that there has to be social distancing, there has to be hand washing, there has to be masks, and it doesn't look like any of this is going away anytime soon. And if the kids want to be able to stay in school, it's all of those things. Amanda, I feel for your 6th graders. That's like so not fun. I think my kids would be crushed if they had to come back home again.
And to build off that a little bit, for the people who are going to say, well, the hospitalizations are low for kids, so whatever, they're going to get it. And yeah, they probably, as far as statistically, I mean, who wants to talk about kids and getting a severe reaction to COVID-19? It's awful. It's absolutely awful. Statistically, obviously, that number is going to be very low, but people have to remember that kids are a vector point, and that's the concern. It's not. It's the vector point of the kids bringing the COVID-19 home to a household, which almost guarantees its spread amongst the household because it's so transmissible. So just remember that when we're talking about kids and masking and vaccines and whatever, it's that is also a concern, and not just the infection in the child itself.
Yeah. Lynn's noticing your count on your desk there. I think your count got a couple comments last time as well. Yes, that is exactly
she just made the connection. Yes, that's the connection.
That is the connection, Lynn.
Yes.
He's constantly counting for us in the newsroom, and it's so important because we're lucky enough that we have you, that it provides this perspective on how the numbers look here in Arizona, and we make sense of it. Oh no, Jennifer writes, you're so right. My daughter goes to Hamilton and just tested positive. Jennifer, hopefully she feels better soon. All right. I think we are getting a little bit closer to wrapping things up. You talked about what you want to check out in the coming days. Another country to watch, by the way, I know some people are like, oh, I don't trust this or I don't trust that. Watch what's happening in Israel. They've kind of been 2 steps ahead of us in a lot of things. Israel actually approved the 3rd shot for 50 plus. 40 plus is going to be approved soon. Hannah, we see all your comments there. I guess you need a shout out, so I'll make sure that you get a shout out. Israel 50 plus has already been approved for their 3rd shot. 40 plus is about to get their approval for shots. So it's one of the things that if you sort of want a preview of what's happening around the world, it's one of the places to watch because they're kind of just a step ahead in us. Hannah seems like she'd be fun at parties. No parties right now, Alex. Yes. I'm just kidding. Just do it safely, please.
Probably off the Christmas card list, whatever.
Just do it safely. Okay. Any other things that you want to highlight before we say goodbye to everybody?
No, just listen to the vaccine numbers as they come in. Hopefully our vaccinations are going to keep going up. Again, hopefully we're getting close to that hill. That's what everybody wants to see is that RT rate start to go down. So I know we didn't cover it. We'll cover it later, but getting those numbers down.
Yeah, Alex is writing socially distanced parties. Sounds good. Just want you to be safe. Thank you too, Rand. Hopefully you feel good soon. Laura writes, get vaccinated. Absolutely. Feel better. Be safe. Let me let you know where to find us outside of these updates. By the way, it kind of sounds like we're going to be back once a week, Garrett. So
yes, we're back once a week. Yes.
We'll be doing these updates on Friday afternoon. So get your questions over to us, and you can do that by finding Garrett on Twitter at Garrett_Archer. And I can be found on Twitter also at Katie Rammel. A lot of you are watching right now live with us on Facebook. And if that's your preferred place to catch up, facebook.com/news from Katie. And let me think. Oh, we've got newscasts coming up at 4, 5, 6, 9, and 10 p.m. where you can get the very latest coronavirus headlines. Also, one thing we didn't touch on, this fight with the school district where the teacher is suing the school. They were the first one to decide to go ahead and put in a mask mandate, and he fought back against that with a lawsuit. The oral arguments were going on as we came into this. So thank you, Alan, for the nice glasses. I appreciate that. We were just getting into this when we came on the air here with you. So we'll have updates in our newscast with anything, if anything's decided or anything comes from that. And what else did I forget? Oh, updates for schools. Arizona schools, right there at the bottom of your screen. We get so many letters in from parents when they're sent them from the schools I can't even keep up with them, but we have them all in one place. All of our reporters working to put that information there. And that's at abc15.com schools. It's got the link to every school district that has a forward-facing, a public-facing dashboard where you can click on your child's school district or any school district to sort of see their latest numbers. Both usually, most of them post active cases and past cases, so that you can kind of make some decisions appropriately. So that can be found there, and all of our coronavirus reporting at abc15.com. That's it for us. We will see you guys here hopefully next Friday. In the meantime, please be safe out there.